And hopefully that will be working. Perfect. It is recording. So the topic of our webinar today is called What Vaccines Are Recommended for You? Today, we are going to discuss the vaccines that are recommended for aging adults. And we are also going to touch on how vaccines are covered by Security's Medicare plans. Our presenter today is Andrea Bilderback, and I hope that I pronounced that correctly. She is a clinical pharmacy specialist with us here at Security Health Plan. She has over 8 years of experience in pharmacy, including hospital and retail pharmacy. She is certified to administer vaccinations and has been doing so since 2014. Andrea strives to educate people on the benefits of vaccinations and likes to provide evidence-based resources with accurate information for people to be able to make an educated decision about their care. So with that said, I am going to hand it over to you, Andrea, and you can kick off the presentation.
Sounds good. Thank you, Michelle. So like she said, I just want to say thank you for all of you for joining me today. I am a clinical pharmacist with Security Health Plan, and today we're going to talk about vaccines specifically related to the Medicare population. So at the end of my presentation today, I want you to be able to identify which vaccines are recommended for you, differentiate between the vaccines that are covered by Medicare Part B and those covered by Medicare Part D, and then also be able to find your own current vaccination status. Let's start off by talking about which vaccines are recommended for you. The CDC provides guidance on recommended vaccines, and I've included a link to this website at the bottom of the slide. So there's a lot of information on this slide, and I know that this table is very difficult to read, but don't worry, I'm going to be zooming in on different sections of the table in the next few slides, and then we'll talk about each section individually. And like Michelle said, we'll also be emailing this out in the next couple of weeks. So this table it's called the Recommended Adult Immunization Schedule, and it outlines which vaccines are recommended for which age group. As you can see, the ages are listed on the top, and then the vaccine is listed on the left. So each vaccine is actually a hyperlink. So if you actually click on the vaccine, it will bring you to more information on that specific vaccine later on in the web page. The colors on the table give more information about what type of recommendation it is. So yellow means that the vaccine is recommended. Purple means the vaccine is recommended only for adults with a certain risk factor. And then light blue means the vaccine is recommended based on a shared decision that's made between you and your doctor. So let's start digging in a little deeper into this table. The first vaccine that I want to talk about today is the flu vaccine. As you might already know, influenza, or the flu, it's a contagious disease that spreads around the US each year between October and May. It can be more dangerous for some people, including those 65 and older, and those with chronic medical conditions or weakened immune systems. So the CDC recommends that everyone 6 months and older get vaccinated for the flu every flu season. So because there are so many different flu viruses and they're always changing, a new flu vaccine is made every year in order to protect against the flu viruses that are believed to be most likely to cause disease in the upcoming flu season. The flu vaccine can be given at the same time as other vaccines, including the COVID vaccine. The flu vaccine is covered by Medicare Part B, and for this flu season, any one dose of a licensed age-appropriate flu vaccine is recommended. All flu vaccines this year are quadrivalent, so that means that they contain 4 components and they protect against 4 different flu viruses. There are some flu vaccines that are approved only for use in people who are 65 and older, and that includes the high-dose flu vaccine Fluzone and the adjuvanted flu vaccine Fluad. So both of these vaccines are designed to help create a stronger immune response in people who are 65 and older. Standard dose flu vaccines can be used in everyone, including those who are 65 and older. The CDC does not recommend one flu vaccine over another at this time. So really any age-appropriate flu vaccine you can get. Just to note, there is a nasal flu vaccine out there called FluMist, but it's only approved for those 2 to 49 years of age. All right, let's now discuss the recommendations provided for the tetanus, diphtheria, and pertussis vaccine. As you can see, 1 dose of Tdap is recommended for everyone, and then a dose of TD or Tdap is recommended every 10 years as a booster. TD and Tdap vaccines can be given at the same time as other vaccines, and they're covered by either Medicare Part B or Part D, depending on the situation. And we'll kind of talk about that a little more as we continue with the presentation. The TD vaccine can prevent tetanus and diphtheria. Tetanus can cause a painful stiffening of the muscles and can lead to serious health problems. And diphtheria can lead to difficulty breathing and heart failure and paralysis. So the Tdap vaccine can prevent against pertussis in addition to preventing against tetanus and diphtheria. So you may have heard pertussis is also known as whooping cough, and it can cause the uncontrollable violent coughing that makes it hard to breathe, eat, and drink. Pertussis is especially dangerous in babies and young children because they can't be vaccinated yet. So again, adults who have never received a dose of Tdap should get a dose of Tdap. And then adults should receive a booster of either Tdap or TD every 10 years after that. In certain circumstances, it may be recommended to get Tdap or TD sooner in cases of like an injury or a burn. So besides the flu vaccine and the tetanus vaccine, the shingles vaccine is probably something you've heard about. As you can see from the table, everyone 50 and older is recommended by the CDC to receive 2 doses of the recombinant zoster vaccine, also known as Shingrix. So shingles, as you may have heard, is a very painful skin rash that usually develops with blisters. It's also referred to as herpes zoster. And your risk of getting shingles increases as you age. The most common complication of shingles is a long-term nerve pain that's called postherpetic neuralgia. The recombinant shingles vaccine, Shingrix, is again recommended for adults 50 and older without serious immune problems. So this includes those who have had shingles previously, who have received Zostavax previously, and those who are taking a low-dose immunosuppressive therapy. Shingrix is given in 2 separate doses about 2 to 6 months apart. It's only covered by Medicare Part D. So those without Part D coverage will not have coverage for Shingrix. It can be given at the same time as other vaccines. All right, so the next vaccines we'll discuss today are the pneumonia vaccines. So there are 2 types of pneumonia vaccine that we'll discuss: the pneumococcal conjugate, PCV13, also known as Prevnar 13, and then the pneumococcal polysaccharide, PPSV23, also known as Pneumovax 23. So both Prevnar 13 and Pneumovax 23 are covered by Medicare Part B, and they can be given at the same time as other vaccines. Pneumovax 23 protects against 23 types of bacteria that can cause pneumonia. and it's recommended for all adults 65 and older. If you already received a dose of Pneumovax 23 prior to turning 65, you're still recommended to get a dose, but you'll have to wait at least 5 years after your first dose of Pneumovax 23 in order to get a second dose. Prevnar 13 protects against 13 types of bacteria that can cause pneumonia, and it's usually given to children in a series of 4 doses. It's only recommended to be given to healthy adults 65 and older who have not already received Prevnar 13, only based on a decision that they make between themselves and a healthcare provider. So something you'll have to talk to your doctor about. Pneumovax 23 is also recommended for people 18 and older that have certain medical conditions that lead to an increased risk of pneumonia. So people with chronic heart, lung, or liver disease, those with diabetes, alcoholism, and those who smoke cigarettes are recommended to get this dose. For those with an immunocompromising condition, for example, HIV or cancer, 1 dose of Prevnar 13 and 2 doses of Pneumovax 23 are recommended. Finally, the CDC recommends that everyone 5 years of age and older be vaccinated against COVID-19. The Pfizer vaccine is a 2-dose series given 3 weeks apart. The Moderna vaccine is a 2-dose series given 4 weeks apart. And then the Johnson & Johnson vaccine is a 1-dose series. An additional primary dose is recommended for people who are immunocompromised. So again, people receiving cancer treatment or those with an organ transplant or advanced HIV, these are some of those immunocompromising conditions. They should receive the additional primary dose at least 28 days after their second dose of the Pfizer or the Moderna vaccine. An additional primary dose is not recommended in those who have received the Johnson & Johnson vaccine. Only a booster dose is recommended in these people. The COVID vaccine is covered by an original Medicare at this time, and so everyone with Medicare will have coverage for this. So let's discuss the COVID-19 booster vaccine recommendations. For individuals who received the Pfizer or Moderna vaccine, you are eligible for a booster 6 months after your second COVID shot, if you're 65 and older, or if you're 18 and older with some of the risk factors listed on this slide. For those who received the Johnson & Johnson vaccine, all who are 18 and older are eligible for a booster, and this occurs at least 2 months after your initial shot. Any of the COVID-19 vaccines authorized in the US can be used for the booster shot, regardless of the vaccine product that was used for the primary vaccination series. All right, let's recap the vaccines that we discussed during this presentation. That was a lot of information. The flu vaccine, again, is recommended every year during flu season. The TD or Tdap vaccine is recommended for everyone. The Tdap is recommended for everyone at least once, and then a dose of TD or Tdap is recommended every 10 years. For the pneumonia vaccine, Pneumovax 23 is recommended for everyone at age 65, regardless of prior vaccination status. Prevnar 13 is recommended only after a shared clinical decision made between you and your doctor. The shingles vaccine series, which is a 2-dose series of Shingrix, is recommended for everyone starting at age 50, regardless of prior vaccination or prior history of shingles itself. The COVID vaccine series is recommended for everyone 5 and older, and then the booster doses are recommended based on your risk and your age. So which vaccines are covered by your insurance? These are kind of split up between Part B covered vaccines and Part D covered vaccines. So vaccines that are covered under Medicare Part B include the flu vaccine, the pneumonia vaccines, and any vaccines that you receive after exposure to a dangerous virus or disease. For example, if you step on a rusty nail and you need to get a tetanus shot, this would be covered under Medicare Part B. Or if, for example, you're bitten by a dog and you need a rabies shot, again, this would be covered by Part B. Medicare Part D is the prescription drug benefit, and most vaccines are covered by Medicare Part D, including Shingrix and the TD and Tdap vaccines when being given as a booster. And there are other vaccines covered by Part D that we didn't talk about today as well. So again, Part D vaccines are only covered if a member has that Part D eligibility. And then this is just another summary slide for the vaccine coverage. Again, Medicare Part B covers the flu, the pneumonia, and the tetanus vaccine when given post-exposure. Part D covers shingles, the Shingrix vaccine, and then the tetanus vaccine when being given as a booster. And then the COVID-19 vaccine is covered under original Medicare. So now that you know which vaccines are covered by what part of Medicare, you're probably wondering what the cost is. So it really depends on the type of Medicare plan that you have. So the coverage on this slide specifically refers to members with plans from Security Health Plan. And for the most accurate information about your plan's coverage, I recommend that you talk to your health insurance carrier. So we'll start with the members with our Medicare Advantage with Prescription Drug Coverage Plan, or MAPD. So these members will have $0 copays on both Part B and Part D covered vaccines. Members with our Dual Eligible Special Needs Plan, or DSNP, will have $0 copays on Part B covered vaccines, but they will have a small copay on Part D covered vaccines, depending on the low income subsidy or LIS level that the member falls into. Members with our Medicare Advantage plan without prescription drug coverage and those with our Medicare Supplement plan, they will have a $0 copay on Part B covered vaccines. They will not have coverage on Part D covered vaccines because they do not have that prescription drug coverage. And then members with our Medicare Medical Savings Account, or MSA, they will pay 100% of their Part B covered vaccines until their maximum out-of-pocket is met. So once that is met, they will have a $0 copay on Part B covered vaccines. Members with an MSA do not have coverage on Part D covered vaccines, but they can use money from their MSA towards a Part D covered vaccine, just knowing that this will not go towards the deductible. So in general, in-network pharmacies are the preferred location to receive your vaccines. However, a doctor's office is also acceptable. Just know that the copay will be the same regardless. All right, so where can you find your vaccination status? Your current vaccination status can be found by using the Wisconsin Immunization Registry, also known as WIR. This is an internet database that tracks vaccine records for Wisconsin children and adults. You do have access to look up your own vaccine record in WIR using your name, date of birth, and social security number, or your Medicaid ID or healthcare member ID number. This database keeps track of your previous vaccinations, only those that are received in Wisconsin. And it also gives you a recommended chart with vaccines that you may be due for now or in the upcoming years to help you organize. If you can't access the WIR, the Wisconsin Immunization Registry, you can always ask your doctor's office or pharmacy for a record of your vaccination history. We covered a lot of information today, and I know it may seem a little overwhelming, But the good news is that this information is readily available to you and your healthcare provider, and you can reference it as many times as you like. The link to the CDC immunization schedule, again, is listed on this slide. You can print a copy of the schedule, or you can just save it to your web pages. If you have a smartphone, you can also download an app on your phone so that you have that recommended schedule at your fingertips. Again, as Michelle mentioned, we'll be sending this out in the next couple of weeks for your reference as well. And here's a list of the references that I used today. And with that, I just want to open up the floor to any questions or comments that you may have that I can try to answer for you.
Thank you so much, Andrea. Lots of great information. Again, the floor is open for people to type your questions into the chat. If you would like to do that. We did have several questions that were submitted ahead of time to us through our website, and people responding to the invitation to the webinar. So I'd love to, if there are questions from the people who are watching right now, I'd love to get to your questions first. But if there aren't any right now, I'm going to go ahead and start reading off the questions that were submitted ahead of time. So the first question is, if the shingles shot is recommended, why isn't it free as a preventive measure?
So to answer this question, unlike the flu and the pneumonia vaccines, which are fully covered as preventive measures under Medicare Part B, the shingles vaccine is covered under Medicare Part D, which is the prescription drug coverage. So just again, knowing that those people with Medicare Part D, they do have full coverage on the shingles vaccine. Actually, Security Health Plan cannot cover the shingles vaccine under non-prescription or non-Part D plans because the Centers for Medicare and Medicaid Services actually rejected this coverage. They did attempt to do this in the past, but it was rejected. So really just those under Medicare Part D will have the full coverage.
Great. All right, the next question is, if a person has received the first shingles injection years ago, do we need to get the next set of 2 injections now, and why?
All right, so yes, if you've received Zostavax, which is the old shingles shot, if you've received that in the past, it's still recommended to get Shingrix. And the reasoning for this is that Shingrix was actually found to be more effective at preventing shingles than Zostavax. And I'll just mention, in clinical trials, Shingrix reduced the risk of shingles and the postherpetic neuralgia complication by more than 90% in people 50 and older, whereas Zostavax, which really only reduced that risk by 50%. So again, it is absolutely recommended just because of that additional coverage.
Great, good information. All right. Next question is, can you get the regular flu shot at the same time as a COVID booster shot?
And the answer to that is yes, you can get the flu vaccine at the same time as the COVID booster vaccine, or really any of the COVID vaccines at any point that you're at. Any of those vaccines can be given at the same time.
Okay. All right, this one is a bit specific, but it says, I want to learn about receiving the Shingrix shingle shot. I received my COVID booster shot on August 21st and will be receiving a Botox injection in my left eye on November 22nd. So I think that's next week. Is there a waiting time I should wait before I get the shingle shot?
Great question. So first off, regarding the shingles and the COVID vaccines, neither the shingles vaccine or the COVID vaccines are live viruses or live vaccines. So therefore, these vaccines can be administered simultaneously or at any interval between the doses. There really isn't a specific guideline on the timing of Botox with other vaccines. with either the shingles or the COVID vaccine. There do not appear to be any drug-drug interactions, and in general, Botox is not thought to alter your immune response to vaccines. I did find that some Botox clinics do recommend spacing your Botox injection by at least 2 weeks before and after any vaccines. So, you know, something you can ask your Botox clinic, but I guess in general, I would recommend getting your shingles vaccine 2 weeks after your Botox injection.
Okay, great. And we did have some last minute submissions of questions. So Andrea, you might not be aware, so you might have to just answer on the fly here, but let's see. I'm trying to look through here to see if any of them were actually answered within the presentation already. I think you answered this one before. Will security ever pay for the shingle shot in the future if you are on a lower cost Medicare plan?
So again, with the shingle shot, it's covered by plans that have that prescription drug coverage or Part D coverage. Mm-hmm. People with the DSNP or dual eligible special needs plan, they do have a small copay just based on the level that the member is in. And that's just because of the way that that plan is set up. So plans without the prescription drug, again, will not have coverage on the shingles vaccine.
Okay. All right, this is a COVID-19 vaccine question. It says, I received my third Moderna shot. I was eligible because I have a compromised immune system. My question is, will I need any more shots? And was that third shot the same as a booster shot? Thanks.
So I'll kind of split this up. So the additional dose is intended to provide an immunocompromised person. I guess it's intended to improve that person's response to their initial vaccine series. That's the additional dose, specifically for immunocompromised people. And then a booster shot is administered to people who have completed their vaccine series and their protection has maybe waned over time. So right now, the CDC recommends that immunocompromised people should follow the same booster recommendations for the general population. So people 50 and older and residents 18 and older who live in a long-term care setting should receive a single COVID booster 6 months after completing their additional primary dose that they received. So up to 4 vaccines can be given in this population. And then others who don't reside in the long-term care could still receive a booster dose after their additional primary dose. So depending on your risk, my answer would be yes, the booster shot is still recommended even after your third additional dose. So you would receive up to 4 doses.
Okay. Well, excellent. So we are at the top of the hour now. So if there were any questions here that we did not get to or were not covered in the presentation, we will be sure to get those answered and include them in the email that we're going to send out to everybody within the next 2 weeks. So just a reminder, that email will be coming to you. It'll include the link to the recording of this webinar, along with the link that Andrea included in her presentation. So you can easily get access to all the sites that she recommended. And I think that's about it for today. And I did not see any questions that were submitted in the chat. So hopefully we got to everything that everyone was hoping to get out of the webinar today. Thank you so much for joining us. And Andrea, thank you so much for your time and agreeing to be our presenter and our expert on vaccines today.
Of course. Thank you, everyone.
Great. Thank you, everyone. Have a great day.